in June of 1997. Obesity is now recognized as a disease by itself. It is the principal cause of many non-transmissible diseases, including diabetes type 2, coronary disease, stroke. It predisposes people to various types of cancer, gallbladder diseases, musculoskeletal afflictions, and respiratory problems. Because obesity is such a growing problem, many obese people are searching for ways to aid in their weight loss. One of these possible solutions is lap band surgery. Lap band surgery has been performed at Port Huron Hospital since 2002. According to the nurses at the Lap Band Center, Dr. Bassani and Dr. Bout, the two surgeons who performed the surgery, have done just over 1,500. Therefore, it is likely or perhaps possible that you will in the future or do know someone who has had this surgery. Therefore, by listening to the speech, I hope you understand a little bit more about what these people who have had the surgery have gone through. So today, in my speech, I'm going to cover what exactly lap band surgery entails, the qualifications to have the surgery, as well as the pros and cons of the surgery. So let's get started. According to the Department of Health and Human Services, 64% of adult Americans are obese. That's a huge number. And as a result of this, many people are trying to lose weight through diet and exercise. However, surgery is also another option. My information is taken from the pamphlet, A Surgical Aid in the Treatment of Morbid Obesity, and that's also where the pictures in my poster are from. So, what is exactly lap band surgery? Well, lap band surgery is a laparoscopic surgery, and what the doctor does is he makes 5 small incisions on a person's stomach, and then he inserts the lap band system in. And what the lap band system is it's just a band. He buckles it around the stomach like a belt, and it divides your stomach into 2 areas. The first area is about the size of a golf ball, and that's the area a lap band surgery patient has for eating food. That's it. The larger part is just for transferring the food down to the intestines. Now, one of the benefits of having lap band surgery is that it is adjustable. So, what the doctors can do is, this is like an elastic tube, and what they do is you've got a port located just outside your skin, and they take a shot very much the size of a flu shot, and they can fill the tube with a saline solution, which is just a salty liquid much like other bodily fluids. And this allows them to tighten the band in order to allow lap band surgery patients to lose weight and feel more satisfied with the food they eat. Now, before you can have lap band surgery, there are some qualifications that you have to fulfill. The first one is that your BMI, or body mass index, has to be over 40. Now, you're probably like, BMI, that's a little medical gibberish. Well, according to whathealth.com, your BMI is your weight times 703. And then you take that number and you divide it by your height squared, and that'll give you your BMI. Now, if it's over 40, you qualify for lap band surgery. The second qualification is that you have had to suffer from obesity for at least 5 years. And most importantly, you have had to have tried other non-surgical ways to lose weight. For instance, you've had to try diet and exercise, as well as perhaps taking diet pills, just because they want to make sure that this isn't some Saturday night decision like I'll go have surgery. They want you to understand that this is a serious surgery and requires a lot of consideration. The third qualification is that you cannot have a disease that is causing you to suffer from obesity. It can only be by overeating. Finally, let's take a look at the pros and cons of having lap band surgery. Some of the benefits are, as I said before, it can be adjusted. And this is also beneficial for women who have the surgery, because let's say you become pregnant. Well, the doctors can loosen the band, take the saline out, and that allows you to gain the weight needed for the surgery in order to support the baby. And once you have the baby, they can then refill the band, and you can continue on your weight loss journey. And that's a real benefit for a lot of people. Another benefit is it can be removed. After 2 years, let's say you're like, wow, the surgery's just not for me. They can go ahead and they can take the lap band off, and you can continue, and your stomach will go back to normal. Another benefit that people see in the surgery is it provides forced weight loss. A lot of people see this as a benefit because let's say it's Sunday night and you've just had a large dinner and you want that piece of cake. Well, if you're just dieting, that really won't affect you much. But let's say you're a lap band surgery patient and you had the large dinner and you went for the piece of cake, you could spend the night vomiting on the bathroom floor because your stomach's just the size of a golf ball and really can't hold that much food. Some of the negatives people see of lap band surgery are, in a U.S. clinical study conducted on 229 patients, 88% of those patients suffered from nausea and vomiting. That's a huge number and definitely something that you have to consider if you're willing to live with, if you're considering lap band surgery. Another number is, out of 229 of those patients, 34% of them had their band slip, which just means that their band slipped lower on their stomach, thereby and the doctor then had to go in and remove it. Or not remove it, I'm sorry, and correct it in order to move it up. So that is something to consider also. Some other less serious results of the surgery are belching. A lot of lap band surgery patients suffer from that, as well as difficulty swallowing food. For a normal person, you say chew 10 times before you swallow your food. But for a lap band surgery patient, you're looking at 30, maybe 40 times before you swallow. So that's something that you have to consider. Also, a lot of lap band surgery patients have trouble eating normal foods like steak. Steak's a little too chewy for your smaller stomach to digest, so there's some foods that people have to give up. Which leads me to my next problem that a lot of people have, is they just have problems adjusting to the smaller meals and lifestyle adjustments that are necessary with this surgery. In conclusion, the choice to have lap band surgery is obviously a difficult one. It is by no means the answer to everyone's search for weight loss, yet it can be a helpful tool. It still requires individuals to commit themselves to diet changes and lifestyle adjustments. There is always the possibility of complications with this surgery. However, it has aided many individuals in losing their excess weight and obtaining a healthier lifestyle. Thank you.